Imagine a nutrient so pivotal that its deficiency could sway the health trajectory of your entire body, influencing everything from your bones to your brain. Vitamin D, often dubbed the sunshine vitamin, is that nutrient. As we navigate through 2024, the significance of vitamin D continues to unfold through groundbreaking research, revealing its essential role in not only maintaining our physical health, but also in protecting against a myriad of modern diseases. Its influence spans far and wide, making vitamin D not just a beneficial nutrient, but a necessary one for optimal health. Vitamin D, a fat-soluble vitamin, is unique because it can be synthesized by the human body in response to sunlight exposure. It exists in two main forms: D2, or ergocalciferol, which is largely obtained from plant-based foods and supplements, and D3, or cholecalciferol, which is derived from animal sources and sunlight. This vitamin is pivotal for calcium absorption, making it a cornerstone of bone health, but its roles extend to many other critical functions within the body. As we peel back the layers of vitamin D's broad impact, it becomes evident why it is more than just a bone health ally. Research has highlighted its profound effects on the immune system, mental health, and chronic disease prevention, positioning this nutrient as a key player in holistic health management. It's no secret that sunlight is a primary natural source of vitamin D, as UV rays from the sun help convert cholesterol in the skin into vitamin D3. However, with rising skin cancer awareness and increased use of sunscreen, many individuals are at a risk of not getting sufficient sun exposure. The sunshine skin cancer dilemma forces us to balance between adequate vitamin D synthesis and skin cancer prevention. This paradox has led to a significant portion of the global population experiencing vitamin D insufficiency despite the abundance of sunshine. For instance, in regions like Scandinavia, despite long summer days, the extended winter months with minimal sunlight contribute to widespread deficiency. Vitamin D's classical role is to facilitate calcium absorption in the gut, which is crucial for the formation and maintenance of strong bones. Without it, even with a high calcium intake, the body cannot properly calcify bones. This is particularly essential as we age and bone density naturally decreases. A deficiency in vitamin D can lead to conditions like rickets in children and osteoporosis in adults. Case studies highlight the effectiveness of vitamin D supplementation in improving bone mineral density and reducing fracture rates in older adults. Moreover, emerging research connects adequate vitamin D levels with improved recovery post-bone fracture surgery. The immune boost vitamin D's role in immunity. Recent years have seen a surge in understanding the immune modulating effects of vitamin D. It plays a critical role in activating immune defenses and has been found to reduce the risk of viral infections, including the flu and upper respiratory tract infections. Furthermore, vitamin D is recognized for its anti-inflammatory properties, vital in controlling immune response and preventing overactive immune disorders. In 2024, a landmark study demonstrated how vitamin D supplementation could significantly lower the incidence of autoimmune diseases when administered in early stages. This discovery has shifted global perspective towards preventive healthcare measures involving vitamin D. The brain is another beneficiary of vitamin D. There is emerging evidence suggesting that adequate vitamin D levels are linked to a lower risk of mental health issues, such as depression and cognitive decline. The exact mechanisms are still being studied, but vitamin D receptors throughout the brain suggest a direct effect on mood-regulating areas. A 2023 meta-analysis showed a 20% reduction in depression symptoms among individuals with vitamin D supplementation who were previously deficient. This points to the potential of vitamin D in supporting mental health strategies. The impact of vitamin D deficiency is broad and significant, affecting various aspects of health. bone deformities, weakened immune system, increased risk of chronic diseases like type 2 diabetes, certain cancers, and cardiovascular diseases are just a few of the consequences documented by extensive research. Public health campaigns are increasingly focusing on these implications, using data from around the world to encourage proactive management of vitamin D levels through lifestyle changes and supplementation. Innovation in vitamin D research has been remarkable. Recently, scientists have developed new forms of vitamin D supplementation with enhanced absorption and longer-lasting effects. Also, genetic studies in 2024 have begun to uncover how individual differences in vitamin D metabolism can affect personal health outcomes, paving the way for personalized nutritional advice. These advancements are not only enhancing our understanding of vitamin D, but are also improving how we utilize this nutrient to prevent disease and promote health across different populations. To maintain sufficient vitamin D levels, a combination of dietary intake, sensible sun exposure, and supplementation is necessary. Foods rich in vitamin D, such as fatty fish, egg yolks, and fortified products, should be incorporated into the diet. Sensible sun exposure, ideally 10-15 minutes several times a week without sunscreen, is recommended for most people. However, given the variation in sun exposure based on geography, season, and lifestyle, vitamin D supplements are beneficial for many, particularly during winter months or for those with limited sun exposure. Regular testing of vitamin D levels can help tailor individual needs more effectively. In conclusion, as we continue to investigate and appreciate the myriad benefits of vitamin D, it remains a cornerstone of health that intersects with every aspect of well-being, from our bones to our brains. The information presented here outlines a multifaceted approach to managing and optimizing vitamin D levels for a healthier, more resilient population in 2024 and beyond. Imagine a nutrient so pivotal that its deficiency could sway the health trajectory of your entire body, influencing everything from your bones to your brain. Vitamin D, often dubbed the sunshine vitamin, is that nutrient. As we navigate through 2024, the significance of vitamin D continues to unfold through groundbreaking research, revealing its essential role in not only maintaining our physical health, but also in protecting against a myriad of modern diseases. Its influence spans far and wide, making vitamin D not just a beneficial nutrient, but a necessary one for optimal health.